Well, the Sunshine State could become the first in the country to drop vaccine mandates for school-aged kids. Florida leaders argue this plan is about parents' rights, but there are also concerns from other parents, teachers, and medical professionals. Joining us now to talk more is Forbes Public Health Senior Contributor, Dr. Omer Awan. Nice to see you today. Thanks for being here.
Nice to see you, Anna. Thanks for having me.
So Florida's Surgeon General wants to end these vaccine mandates for Hep B, chickenpox, meningitis, and pneumonia. What kind of an impact could this have on Florida schools?
It could have a significant impact, Anna, particularly because a lot of these diseases are infectious diseases and they can spread very easily. And we've seen firsthand what happens when vaccination rates decline. If we take a look at what happened in Texas, for example, with measles, because of decreased vaccination rates, we've had over 1,900 cases of measles and 2 deaths, by the way. And these are all entirely preventable with vaccines. And again, we've also seen what's happened with whooping cough, with more than 25,000 cases in America. 3 kids have died in Kentucky, in the state of Kentucky. So this is a serious issue. And because of declining vaccination rates, I'm afraid that infectious diseases can spread even further.
Do you think if medical professionals, these pharmaceutical companies, and the federal government had been more upfront about the risks associated with the COVID vaccine and all of the mandates that were associated with that, do you think there wouldn't be so much vaccine hesitancy in this country?
I think that's a great point, Anna. We do need to be a little bit more transparent. And yes, the pharmaceutical companies and medical professionals need to be more transparent and clear. And I think this is part of the problem, the idea that we haven't been upfront about risks and benefits. And I think parents are struggling often about risks and benefits. And going forward, I think there needs to be a lot more dialogue, a lot more transparency so that kids and parents can understand why vaccines are there to begin with. You know, vaccine mandates have been there to protect kids from getting sick, similar to how there are laws like for car seats, for example, or seatbelts that protect kids from getting injured. So I think the more that parents understand why we have these mandates to begin with, I think we'll start to see vaccine hesitancy decline somewhat.
Yeah, look, we've seen an explosion in homeschooling since COVID as well. And a lot of that was parents who didn't want to have these vaccine mandates, right? They wanted what they called medical freedom. So do you think the other side, those who are in favor of these vaccines, will now want to homeschool their kids in the state of Florida, for example?
It's possible because this issue has been so polarizing. I mean, we take a look at what's happened with American politics. I mean, these vaccines have really resulted in heated debates. And yes, it's absolutely possible that those that are in favor will school children, they'll homeschool their kids. But I think what we need to understand is that, yes, personal choices and personal freedoms are very important. You know, as a parent of 4, I understand that, you know, personal choices and personal freedom are extremely important, but they also need to be balanced with community safety, particularly in shared spaces like schools, because your choice to vaccinate your child affects not only your child, but also the health of others. Remember, if you decide not to vaccinate your child and that kid gets sick, they can spread that disease to other individuals. I think that's an important public health point for parents to understand.
Yeah, what's the likelihood that we will see increased rates there in Florida of all of these concerns on our screen, if we want to put those back up, with chickenpox, Hep B, everything else?
The concern would be high because remember, Florida is a high tourism, high vacation state. I myself am going to Florida in a couple of weeks and taking my kids there to Disney World. I think, you know, infectious diseases don't have borders. I know, you know, states have borders, but infectious diseases don't, and they can spread very easily. And we already have a measles outbreak in South Carolina, remember, a neighboring state. So the rate and the probability of these diseases spreading in Florida would be very high.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.